Hi, my name is Navin Verghese. I'm a Consultant Spinal Surgeon. I work here in Santa Maria Hospital, offering a full range of adult spinal surgery, from the more routine procedures and problems through to complex, revisional, redo surgeries and minimally invasive surgery, which is my main specialist interest. Lumbar discectomy is the historic term for the procedure from 10-20 years ago, where the operation was performed via a big cut, usually 2, 3, 4, 5 inches, required lengthy hospital stay due to the amount of tissue trauma performed and imparted on the patient to perform the procedure. In this day and age, over the past 5 to 10 years, we have significant advances in retractor technology to pull the muscles apart, to visualization, in terms of theatre lighting, loops, magnification and microscopes. This therefore allows us to perform a fairly minimally invasive procedure to perform a discectomy, and usually one, sometimes day case stays for the patient. We perform this procedure for a bulging disc in the lumbar spine, which is pressing on a lumbar nerve root. This causes a symptom known as sciatica, which is classically pain radiating from the back through to the buttock, down and along the course of the sciatic nerve distribution, which tends to end up in the calf or the foot, or any variation in between. There's a common misconception that sciatica, or the need for a lumbar discectomy, is due purely to the bulging disc, for example, identified on an MRI scan. However, we don't perform this procedure purely for back pain. It has to be in conjunction with back pain radiating into the leg. That's when spinal surgery and lumbar discectomy surgery in particular can have a very high success rate. Lumbar discectomy is generally a very safe and very quick and effective procedure. It's approximately 30 to 60 minutes long. It will involve an inpatient hospital stay. Some patients can have it in a day case also, but generally it's an overnight stay in hospital. There will be moderate backache post-operatively, and this can be managed with simple painkillers, and you will have physiotherapy thereafter. The mainstay of physiotherapy is to prevent any scarring around the nerve root, what we term perineal fibrosis. Your physiotherapist will be in close contact with you throughout your course, and they will be recommending what we term neural glide exercises, as well as core stability training. Lumbar microdiscectomy is a 30 to 60 minute operation. It's generally a very safe, effective procedure. It will involve an incision approximately 2 to 3 centimeters in your lower back. Everyone has slightly different incision size depending on their body shape. Following that, we strip a small area of muscle to allow us access to the lamina. We then make a small cut in the bone called a laminotomy, which allows us access into the spinal canal. That's where the disc bulge and the nerve roots reside. We then take pressure off the nerve, what we term a decompression. Following that, we're able then to identify the bulging disc and remove just that section of disc which is bulging. We don't remove the whole disc, because that can cause a fair amount of pain post-operatively and can cause future implications to the health of that disc. So we just take away the bit of disc which we need to. Generally, that results in significant and almost immediate improvement in patient sciatica, which most patients do notice as soon as they wake up in recovery. Some patients, it can take a few weeks before they notice the benefit. Generally, this is an overnight stay in hospital. Most patients then are able to return to normal day-to-day duties. Obviously, there are a few do's and don'ts, heavy lifting. A lot of patients are keen to get back to running, and I would certainly caution that at least for the first 6 weeks, sometimes 3 months. Most patients can get back to work and driving by 4 to 6 week stage, but more manual jobs, you will need to wait 3 months. The concern is, as I previously stated, is the risk of re-herniating, and therefore it's a fine line between doing too little and too much, and you'll be guided through this by your physiotherapist. Sciatica can be an extraordinarily painful condition. A lot of patients really struggle with this, certainly in the first few weeks or so. Reassuringly, 90% of patients do get better with time, but this can take 3 to 4 months. That does have implications for people's jobs, people's livelihoods, and just their general mental health from the sheer magnitude of the pain. In Santa Maria Hospital, we do offer a fast-track consultation, MRI and injection service, and this can certainly help patients out, at least in the short-term time frame, to allow them and allow the disc to spontaneously get better. For the 10% of patients where it doesn't get better, then we have the full range of discectomy type procedures available here in Santa Maria.